Hi there, welcome back to the video series number 8 on staying healthy and preventing COVID 19 infection during the current pandemic. This one we going to address the steps that you can take yourself to minimize the risk to you and the family. So, briefly, we have discussed in the previous videos that most people get the virus through the inhalation or swallowing the tiny droplets or via aerosol that contain the virus, what you call the airborne infection. Thus, the use of right type of face masks is prudent to prevent these major source of infection that come through the air. The effective one is the N99 or 3M mask, which has a built-in filter and valve. Because of that, it's easy to use on a routinely manner. Because of the shortage of this mask, now most authorities recommend that to reuse these masks, and there are specific ways of sterilizing them and reuse without damaging the material. So, contrary to the claims, a face mask is an essential item for minimizing the spread of airborne COVID 19 particles, which is the most important and number one cause of route of infection. The use of standard surgical masks or homemade ones when dealing with patients might protect patients, but not necessarily the wearer. Physicians, nurses, medical laboratory staff in particular. So, use of ineffective masks will provide a false sense of security and could be one of the reasons why so many healthcare providers are becoming infected with COVID 19. Despite precautions in the United States and several other countries, during the past 3 weeks, hundreds of healthcare workers have contracted COVID 19. For example, there are more than 100 in Boston, Massachusetts hospital alone. So this is highly unjustifiable. Healthcare workers are trying to protect you and I, and they are getting infected. So having one of them infected with COVID 19 is one too many. So how can you protect yourself to protect others? Firstly, I did mention before, say no to strangers and no visitors at your home. Neither you should ever visit other people's home or social visits. Please cancel them until the entire process is over. You need to assume that everyone you encounter carrying the virus. Don't be afraid to refuse entrance of strangers, including the officials, whoever it is, into your home. No one has the right to enter your home without your personal permission. Why take unnecessary risk? If the person like PHI, if they insist to take talking to you with, speak them outside the home. Don't let them come in while you are wearing a face mask and keeping the distance, at least 2 meters as the WHO says, although that may not be enough. You do not even need to go outside, speak through the door. Why you risk yourself to get yourself infected? Avoiding getting exposed to all other at all cost. This is the right thing to do to safeguard yourself and your family. You are doing the right thing. So also change the habits and stop visiting places and people, specifically those who are not well and the elderly. Curtail all non-essential travel. Work from home or do whatever you do within house premises. When ventures out for essential reasons, do not touch other people or avoid shaking hand altogether, say eyeball, or any greeting that requires touching should be avoided. Unless you are a patient needing medical attention, avoid completely visiting hospital and clinics. Also, avoid visiting relatives who are not living at your home, crowded markets, and other places of any gathering. So, let's look at briefly the eating and drinking habits that could help you to prevent getting infected. Consuming herbs, including ginger and garlic, or consumption of alcohol using tobacco products, will not help you to overcome the disease. These are myths circulating in the internet, but you should not touch this as a cure or prevention of COVID. In fact, the consumption of alcohol and tobacco are likely to make the condition significantly worse. Other habits such as rinsing the nose with saline and drinking hot water, using hair dryers to inhale hot air, or any means of trying to increase the body temperature to get rid of COVID will not work. It only can harm yourself. Similarly, using ultraviolet lights to sanitize the skin surface should not be done. However, the exposure to sunshine, as mentioned in the previous video, between 9:30 and midday, at least 30 days every day, is certainly beneficial, but not through killing COVID, but developing enough vitamin D through your skin to protect yourself by boosting your immunity system. Finally, the second most important thing is to hand washing and other personal hygienic measures. The COVID-19 has a fatty protein and fatty outer layer covering. It's what you call the envelope, which is very sticky. So it can stick to any surface, including the fingers and tables and chairs and doorknobs, etc. However, soap and any detergent erode this outer envelope and making the COVID-19 very vulnerable, and in fact it will disintegrate with time. Similarly, the footwear and clothing that can gather and carry virus inside the house. So keep the footwear outside the house and change the clothes, and putting them in the longer period in sunshine might be able to get rid of some of these. The virus efficiently enters via the mucous membrane, including eyes, nose, mouth, that is buccal mucosa, gastrointestinal tract as well, and indeed the genital and anal region. So do not touch any of these regions if your hands are dirty. So for example, if you go to the bathroom, first wash your hands with soap and water, and when you finish, again wash with soap and water for 20 seconds as and widely circulated in running water. So in the next video, I'm going to discuss about the sanitizing groceries and the importance of good nutrition and keeping healthy to avoid COVID-19. Since then, thank you. Have a good day.